Have you ever looked in the mirror and wondered why your face suddenly looks puffy, your eyes seem darker, your skin appears dull, or new wrinkles seem to appear overnight, even though your skincare routine hasn't changed? What if I told you that your face is often one of the first places your body reveals that something deeper is happening? Your face isn't just about appearance, it's a living dashboard of your internal health. Every day, your skin, eyes, lips, and even the shape of your face respond to what's happening with your hormones, blood sugar, liver function, nutrient status, inflammation, sleep quality, and stress levels. The problem is that most people are taught to treat the surface. If the skin is dry, buy another moisturizer. If the face is puffy, use a cold roller. If there are dark circles, buy concealer. If wrinkles appear, look for another expensive cream. But those approaches are often like repainting a warning light on your car's dashboard instead of fixing the engine. Here's what's really going on inside your body. Your face is one of the most metabolically active tissues you have. Skin cells constantly renew themselves. Collagen is continuously being built and broken down. Blood vessels deliver oxygen and nutrients every second. Hormones communicate with skin cells around the clock. Even tiny changes in your metabolism can show up on your face long before they show up on a blood test or become obvious symptoms. Think of your body like a large company. Your heart is the CEO. Your liver is the manufacturing plant. Your gut is the supply chain. Your hormones are the managers, and your face is the company's public spokesperson. When the company is running smoothly, the spokesperson looks confident, healthy, and energetic. But when the factory is overloaded, supplies are running low, or communication breaks down, the spokesperson is often the first one people notice. That's exactly how your body works. Now, it's important to understand something before we continue. Your face alone cannot diagnose a disease. Many facial changes have multiple possible causes. A puffy face doesn't automatically mean hormone imbalance. Dark circles don't always mean poor sleep. Dry skin isn't always caused by a vitamin deficiency. A proper diagnosis always requires looking at the entire picture, including your symptoms, medical history, physical examination, and sometimes laboratory testing. But your face can provide valuable clues. It's your body's way of saying, pay attention. Something underneath may need your help. What the research shows is that nutritional deficiencies, chronic inflammation, insulin resistance, thyroid disorders, liver dysfunction, and even chronic stress frequently produce visible changes in the skin, hair, lips, eyes, and facial tissues long before more serious complications develop. Recent reviews continue to emphasize that recognizing these external signs can lead to earlier investigation and treatment. Throughout this video, we're going to decode many of the most common facial signs people overlook. We'll talk about why persistent puffiness may have more to do with insulin than sodium, why your skin texture may reveal nutritional deficiencies instead of aging, why dark circles aren't always about lack of sleep, why redness can point toward inflammation, why your lips, tongue, and even eyebrows may offer important clues about your metabolism. And most importantly, I'll show you practical, science-based strategies that address the root causes, not simply cover up the symptoms, because that's where real health begins. If you enjoy learning about the science behind metabolic health and practical ways to optimize your body naturally, consider subscribing. I share evidence-based videos like this every week to help you understand what your body is trying to tell you before small problems become much bigger ones. Now let's start with one of the most common facial changes that people notice, and one of the most misunderstood: facial puffiness. Let's start with something millions of people notice almost every morning. You wake up, walk into the bathroom, look in the mirror, and your face seems swollen. Your cheeks look fuller. Your jawline has almost disappeared. Your eyelids feel heavy. Many people immediately blame salt. I must have eaten too much sodium last night. While sodium can certainly contribute to temporary water retention, it's often only a small piece of a much larger metabolic picture. Here's what's really going on inside your body. Imagine your bloodstream as a network of highways carrying nutrients, hormones, oxygen, and water to every tissue. Water doesn't simply stay where it's supposed to. It's constantly moving between your blood vessels and surrounding tissues, guided by hormones, proteins, minerals, and pressure. When these systems become unbalanced, excess fluid begins collecting in places where it's easy to notice, especially the soft tissues of your face. Let me explain this with a simple analogy. Think of your body's fluid balance like a home's plumbing system. Under normal conditions, water flows in and out smoothly. But if the valves become damaged or pressure builds inside the pipes, water starts leaking into places it doesn't belong. That's exactly what chronic inflammation and insulin resistance can do. Insulin isn't just the hormone that regulates blood sugar. It also tells your kidneys how much sodium and water to hold on to. When insulin levels stay elevated day after day, often because of frequent snacking, sugary beverages, highly processed carbohydrates, poor sleep, and physical inactivity, your kidneys receive repeated signals to retain more sodium. Water naturally follows sodium, leading to fluid retention throughout the body, including the face. This is why many people notice a dramatic reduction in facial puffiness after improving their metabolic health, even before significant weight loss occurs. Research continues to show that hyperinsulinemia, chronically elevated insulin, is closely associated with sodium retention, fluid balance changes, and increased blood pressure. Improving insulin sensitivity helps reverse many of these effects naturally. Another major contributor is chronic inflammation. Inflammation increases the permeability of tiny blood vessels called capillaries. When these vessels become leakier, more fluid escapes into surrounding tissues. That's why inflammatory diets rich in ultra-processed foods, refined sugars, excessive alcohol, and industrial seed oils may contribute to a puffy appearance over time in susceptible individuals. Sleep also plays a surprisingly important role. During deep sleep, your lymphatic system, the body's waste removal network, works more efficiently. This system helps remove excess fluid, inflammatory proteins, and cellular waste. When you consistently sleep only 5 or 6 hours, lymphatic drainage becomes less efficient. The result? You may literally wake up looking more swollen than you would after a full night's rest. And then there's cortisol. Cortisol is your body's primary stress hormone. It's incredibly useful during short periods of stress, but chronically elevated cortisol can disrupt fluid regulation, encourage fat storage, and alter where your body deposits weight. Some people even develop what's commonly described as a moon face, particularly with prolonged exposure to high cortisol levels or corticosteroid medications. Now here's an important distinction. Temporary puffiness after a salty restaurant meal is common and usually resolves within a day. But persistent facial swelling that continues for weeks or months deserves attention. In some cases, it may be related to thyroid disorders, kidney disease, liver disease, allergic reactions, or certain medications. If swelling is sudden, severe, painful, or accompanied by shortness of breath or swelling elsewhere in the body, it's important to seek prompt medical evaluation. So what can you actually do to reduce everyday facial puffiness by addressing the root cause? Start by stabilizing your blood sugar. Instead of eating refined carbohydrates by themselves, build each meal around high-quality protein, fiber-rich vegetables, healthy fats, and minimally processed carbohydrates. This reduces large insulin spikes and supports healthier fluid balance. Aim for at least 25 to 35 grams of protein per meal, depending on your individual needs. Protein not only helps regulate appetite, but also supports stable blood sugar throughout the day. Second, reduce ultra-processed foods rather than simply cutting sodium. Ironically, many processed foods combine excessive sodium with refined carbohydrates and unhealthy fats, creating the perfect recipe for inflammation and fluid retention. Third, prioritize sleep. Consistently getting 7 to 9 hours of quality sleep allows your hormonal systems, lymphatic circulation, and tissue repair mechanisms to function more effectively. Fourth, stay hydrated. It sounds counterintuitive, but drinking too little water can actually encourage your body to conserve fluid. Adequate hydration supports kidney function and helps maintain healthy electrolyte balance. Finally, move your body every day. Even a brisk 20 to 30-minute walk stimulates circulation and lymphatic flow, helping your body naturally clear excess fluid. The goal isn't simply to look less puffy tomorrow morning. The goal is to improve the metabolic systems that determine how your body regulates inflammation, hormones, and fluid every single day. Because when you improve those systems, your face often becomes one of the first places you notice the difference. If this is helpful so far, consider subscribing. Every week, I break down complex health science into practical, evidence-based strategies you can use to improve your metabolism, energy, and long-term health naturally. Next, let's look at another common facial clue that many people dismiss as simply looking tired: dark circles and what they may actually reveal about what's happening inside your body. Now let's move to one of the most common questions people ask. Doctor, why do I always look tired, even when I think I'm getting enough sleep? For many people, the answer begins with the eyes. Dark circles, puffy under eyes, and a tired appearance are often blamed entirely on lack of sleep. And yes, poor sleep is certainly one possible cause, but it's far from the only one. Your eyes sit in one of the thinnest areas of skin on the entire body. The skin beneath your eyes contains very little fat and is packed with tiny blood vessels called capillaries. Because this tissue is so delicate, even small changes in circulation, inflammation, hydration, or nutrient status can become visible. Think of the skin under your eyes like a very thin white curtain covering a window. When the curtain is thick and healthy, very little shows through. But if the curtain becomes thinner or damaged, everything behind it becomes much more noticeable. That's exactly what happens beneath your eyes. Here's what's really going on inside your body. One major contributor is chronic inflammation. When inflammatory chemicals remain elevated for weeks or months, tiny blood vessels can become more fragile and leaky. Blood flow slows, and small amounts of fluid may accumulate beneath the eyes. At the same time, inflammatory stress accelerates collagen breakdown, making the already thin skin even thinner. As collagen decreases, the bluish or purplish blood vessels underneath become more visible, creating the appearance of dark circles. This is one reason why people consuming diets high in ultra-processed foods, added sugars, and excessive alcohol often notice that their eyes look older than the rest of their face. Another important factor is insulin resistance. Many people think insulin only affects blood sugar, but insulin also influences circulation, inflammation, and the health of blood vessels. When insulin remains elevated over long periods, the small vessels around the eyes may not function as efficiently. Combined with chronic inflammation, this can contribute to puffiness and a fatigued appearance. Now let's talk about iron. Iron helps produce hemoglobin, the protein inside red blood cells that carries oxygen throughout your body. If your iron levels are low, your tissues receive less oxygen. The body prioritizes delivering oxygen to vital organs like the brain and heart, while the skin often reflects the shortage first. People with iron deficiency may notice pale skin, fatigue, shortness of breath during activity, brittle nails, and in some cases, more noticeable dark circles. Vitamin B12 and folate deficiencies can create similar problems because they are essential for healthy red blood cell production. Research consistently shows that nutritional deficiencies can affect skin quality, wound healing, and overall appearance long before more severe symptoms develop. Another overlooked factor is chronic allergies. If you've ever heard someone mention allergic shiners, there's actually physiology behind that term. When allergies trigger inflammation inside the nasal passages, blood flow returning from the area around the eyes can slow down. Blood pools in the tiny veins beneath the eyes, making them appear darker. People often spend hundreds of dollars on eye creams, when the real issue may be untreated seasonal allergies or chronic sinus inflammation. Then there's cortisol. When stress becomes chronic, cortisol levels may remain elevated for prolonged periods. High cortisol can interfere with sleep quality, increase inflammation, disrupt collagen production, and accelerate skin aging. Even if you're technically spending 8 hours in bed, poor quality sleep caused by stress may leave your face looking exhausted. Age also plays a role. Beginning in early adulthood, collagen production gradually declines. Fat pads beneath the eyes become thinner and shift position over time. This makes the underlying muscles and blood vessels more visible, even in otherwise healthy individuals. But here's the encouraging news. Lifestyle choices can significantly influence how quickly or slowly these changes occur. So what practical steps can you take? Start with sleep quality, not just sleep quantity. Aim for 7 to 9 hours of consistent, uninterrupted sleep. Try going to bed and waking up at roughly the same time every day, including weekends. Your circadian rhythm thrives on consistency. Next, support collagen production through nutrition. Eat adequate protein each day because collagen is made from amino acids. Include vitamin C-rich foods like citrus fruits, strawberries, kiwi, bell peppers, and broccoli, since vitamin C is essential for collagen synthesis. Don't overlook minerals either. Zinc and copper play important roles in skin repair and connective tissue health. If you frequently feel tired, especially if you also experience dizziness, weakness, or shortness of breath, talk with your healthcare provider about checking your iron status, vitamin B12, and folate levels, rather than guessing or self-prescribing supplements. Hydration matters as well. When you're dehydrated, the skin under the eyes can appear more sunken, making shadows and blood vessels more noticeable. Drinking enough water throughout the day supports healthy circulation and skin elasticity. If allergies are contributing, identifying and managing the trigger may dramatically improve your appearance. Sometimes addressing nasal inflammation does more for dark circles than any cosmetic product ever could. Finally, protect your skin from excessive sun exposure. Ultraviolet radiation accelerates collagen breakdown and increases pigmentation, making dark circles appear even more prominent over time. Wearing sunscreen daily, even on cloudy days, is one of the simplest, long-term investments you can make in your skin health. The important takeaway is this: dark circles are rarely just a cosmetic problem. They can be your body's subtle way of pointing toward inflammation, nutrient deficiencies, poor sleep quality, allergies, or metabolic imbalance. Instead of asking, "What cream should I buy?" start asking, "What is my body trying to tell me?" Because when you address the root cause, healthier skin often follows naturally, and that's a much more powerful solution than simply covering the problem with makeup or concealer. Now, let's talk about something that many people simply accept as a normal part of getting older: dull skin, fine lines, wrinkles, and a loss of that healthy glow. But here's the question I want you to consider. Is your skin aging because of your birthday, or because of what's happening inside your metabolism? The answer is often both. Chronological aging is inevitable. Biological aging is far more flexible. In other words, you can't stop the calendar, but you can influence how quickly your tissues age. Your skin is actually one of the fastest renewing organs in your body. Every few weeks, millions of old skin cells are replaced with new ones. That process requires energy, amino acids, vitamins, minerals, healthy blood flow, and properly functioning hormones. If any of those ingredients are missing, your skin can't rebuild itself as efficiently. Let me explain this with a simple analogy. Imagine you're responsible for maintaining a beautiful brick house. Every day, a few bricks become damaged by wind, rain, and sunlight. Normally, a repair crew arrives, replaces the damaged bricks, and keeps the house looking strong. But what happens if the repair crew runs out of materials? Or if they don't have enough workers? Or if deliveries stop arriving? Eventually, the damage starts accumulating faster than it can be repaired. That's exactly what happens inside your skin. Every day, your body experiences damage from ultraviolet light, pollution, normal metabolism, and inflammation. Under healthy conditions, your body repairs much of that damage using collagen, antioxidants, healthy fats, and nutrients. But when chronic inflammation and poor nutrition overwhelm your repair systems, visible aging accelerates. Here's what's really going on inside your body. One of the biggest drivers is a process called glycation. Whenever blood sugar remains elevated for long periods, excess glucose can attach to proteins throughout the body, including collagen and elastin, the proteins responsible for keeping your skin firm and flexible. These sugar-coated proteins become stiff and brittle. Scientists call the resulting compounds advanced glycation end products, or AGEs. Think of collagen like a brand new rubber band. Healthy collagen stretches and bounces back easily. Now imagine heating that rubber band until it becomes dry and brittle. It no longer stretches well. It cracks much more easily. That's similar to what glycation does to collagen over time. Research has consistently linked higher levels of AGEs with accelerated skin aging, reduced elasticity, and increased wrinkle formation. The same metabolic processes that damage blood vessels, nerves, and other tissues in insulin resistance can also affect the appearance of your skin. This is one reason why consistently high blood sugar doesn't just increase the risk of diabetes, it may also cause people to look older than their actual age. Another important factor is oxidative stress. Every cell in your body naturally produces unstable molecules called free radicals during metabolism. In small amounts, they're completely normal. The problem occurs when free radicals outnumber your antioxidant defenses. It's like having sparks flying inside a wooden building. A few sparks are manageable, but if thousands of sparks are landing everywhere while the fire department is understaffed, damage begins to accumulate. That's oxidative stress. Smoking, excessive alcohol, poor sleep, chronic psychological stress, environmental pollution, and diets low in fruits and vegetables all increase oxidative stress. Meanwhile, colorful plant foods provide antioxidants like vitamin C, vitamin E, carotenoids, and polyphenols that help neutralize these unstable molecules. Protein intake is another area many people underestimate. Collagen isn't something your body magically creates from thin air. It requires amino acids, the building blocks found in protein-rich foods. If someone consistently consumes too little protein, especially as they age, collagen production and tissue repair may gradually decline. Hormones also play a major role. As estrogen, testosterone, growth hormone, and other hormones naturally change with age, collagen production often slows. But lifestyle factors such as resistance training, adequate sleep, stress management, and proper nutrition help support healthier hormonal balance throughout life. So what practical steps can you take to support healthier, younger-looking skin from the inside out? First, stabilize your blood sugar. Instead of starting your day with sugary cereals, pastries, or sweet coffee drinks, begin with a protein-rich breakfast. Eggs, Greek yogurt, cottage cheese, tofu, or a high-quality protein smoothie paired with fiber-rich foods can help reduce large glucose spikes. Second, eat enough protein throughout the day. For many healthy adults, spreading protein evenly across meals supports muscle maintenance and tissue repair better than consuming most of it at dinner. Third, fill at least half of your plate with colorful vegetables. Different colors provide different protective compounds. Deep green spinach, orange carrots, red peppers, purple cabbage, blueberries, and tomatoes all contribute unique antioxidants that help defend your skin against oxidative damage. Fourth, protect your skin from ultraviolet exposure. No nutritional strategy can completely overcome years of unprotected sun exposure. Daily sunscreen, protective clothing, and avoiding excessive midday sun remain among the most effective anti-aging tools supported by decades of research. Fifth, make sleep non-negotiable. During deep sleep, your body releases growth hormone, increases tissue repair, regulates inflammation, and supports collagen maintenance. Think of sleep as your body's overnight renovation crew. Finally, exercise consistently. Resistance training improves insulin sensitivity, enhances circulation, supports healthy hormone function, and helps deliver oxygen and nutrients to skin cells more efficiently. Notice that none of these strategies promise instant results. Real tissue repair takes time. But here's the exciting part. When you improve your metabolism, reduce inflammation, nourish your body properly, and support healthy collagen production, you're not simply making your skin look better. You're improving the health of nearly every organ system at the same time. That's the power of addressing the root cause instead of chasing cosmetic quick fixes. If you're finding this breakdown helpful, consider subscribing. Every week, I share practical, evidence-based strategies to help you optimize your metabolism, energy, and healthy aging naturally. Next, we're going to discuss another facial clue that's surprisingly common but often overlooked: persistent redness, flushing, and what these changes may reveal about inflammation, blood vessels, and your overall metabolic health. Now let's look at another facial change that many people dismiss as, "I just have sensitive skin." Maybe your cheeks are constantly red. Maybe your nose flushes after meals. But here's the most important lesson of all. None of these facial signs exist in isolation. Your body is an incredibly connected system. When your blood sugar improves, inflammation often decreases. When inflammation decreases, your blood vessels function better. When circulation improves, your skin receives more oxygen and nutrients. When you sleep well, cortisol becomes more balanced. When cortisol improves, your metabolism often functions more efficiently. When your metabolism improves, your energy increases. And when all of those systems begin working together, your face frequently reflects those internal improvements. That's why I encourage my patients, and all of you watching, to stop asking one simple question: how can I cover this up? Instead, begin asking a much more powerful question: why is my body showing me this in the first place? That shift in thinking changes everything. It moves you away from symptom management and toward understanding the root cause. And that's the foundation of functional and preventive medicine. Now, it's equally important to remember that facial signs are clues, not diagnoses. Many healthy people naturally have dark circles, rosy cheeks, or thinner eyebrows because of genetics or normal aging. Likewise, serious health conditions can't be diagnosed simply by looking at someone's face. If you notice persistent, worsening, or concerning changes, especially if they're accompanied by fatigue, unexplained weight loss or gain, swelling, jaundice, shortness of breath, chest pain, fever, or other symptoms, please don't rely on internet videos alone. Schedule an evaluation with your healthcare provider. Sometimes a simple blood test or physical examination can provide the answers you need. The encouraging news is that many of the habits that support a healthier face are exactly the same habits that support a healthier body. Eat real, minimally processed foods most of the time. Prioritize protein at every meal. Fill your plate with colorful vegetables and fruits. Choose healthy fats like olive oil, nuts, seeds, and fatty fish. Exercise consistently, including both resistance training and regular walking. Sleep 7 to 9 hours each night. Manage chronic stress before it manages you. Stay hydrated. Avoid smoking and limit excessive alcohol. And keep up with routine preventive health care. None of these habits are glamorous. None promise overnight transformation. But together, they create an internal environment where your body can repair, recover, and thrive. Think of health like building a house. You don't strengthen the roof by painting it. You strengthen the foundation. When the foundation is solid, everything above it becomes stronger. The same is true for your body. Support your metabolism, protect your liver, reduce chronic inflammation, nourish your cells, balance your blood sugar, respect your sleep, move your body every day. Do those things consistently, and the improvements often extend far beyond what you see in the mirror. You'll likely notice better energy, sharper focus, more stable moods, improved blood sugar control, healthier blood pressure, greater resilience as you age. And yes, quite often, a healthier, more vibrant face as well. So here's my challenge for you. Don't try to change everything overnight. Choose one habit from today's video. Maybe it's replacing a sugary breakfast with a protein-rich one. Maybe it's taking a 30-minute walk after dinner. Maybe it's committing to an earlier bedtime. Maybe it's scheduling that checkup you've been postponing. Start with one change. Practice it consistently for the next 2 weeks. Pay attention to how your energy feels. Notice how your sleep changes. Observe what happens to your skin, your mood, and even your reflection in the mirror. Small, consistent actions create remarkable long-term results. Thank you so much for spending this time with me today. I truly hope this video has helped you understand that your face isn't simply about appearance. It's a valuable source of information about your overall health. If you found this video helpful, please give it a thumbs up and share it with someone who might benefit from it. And if you haven't already, subscribe and turn on notifications to join our community. Every week, we explore the science behind metabolic health, nutrition, healthy aging, and practical lifestyle strategies that empower you to take control of your health, naturally. Until next time, take care of your body, listen to what it's trying to tell you, and remember, lasting health doesn't come from chasing symptoms. It comes from understanding and supporting the incredible systems that keep you healthy every single day.